So thank you so much for being here. This is the American Head and Neck Society Historical Archive. We're doing some interviews for the History Committee and the Women in AHNS Committee. And we have Dr. Carol Bradford here with us today. She's the Charles J. Krause Professor of Otolaryngology, as well as the Executive Vice Dean of Academic Affairs at University of Michigan Medical School. So thank you so much for being here.
So thank you so much, Melonie. It's really an honor to be interviewed for the archives.
Yes, and you've been such an important member of our society for a while now. So we're just going to start talking about how you first got into medicine first, and then we'll kind of come into how your role in American Head and Neck Society.
Great, thank you so much. I did not come from a family of doctors. In fact, quite the opposite. I probably come more from a family of lawyers than of doctors. My late father was a lawyer, actually a graduate of the University of Michigan's Law School. He had 3 degrees from Michigan. He also had an MBA and a Bachelor's of Arts degree. My mother was an office manager for Kmart Corporation. And so, but in elementary school, I remember like literally 6th grade, I knew I wanted to be a physician. It was, I think, for me, it was always a calling. I wanted to help people, and I loved science and math. And many people nowadays don't go straight through. I went straight through undergrad, pre-med, med school, residency, and fellowship, and then started my career. So I never took any time off.
Wow. So how did you, once you got into medical school, how did you find out about otolaryngology?
Again, a great question. Early on, I was a class advocate, so I was on the student council, again, at the University of Michigan. I've spent my entire career there, so I'm a bit of a lifer. But I was on student council, and there was a student, a senior medical student, also on student council, who was pursuing otolaryngology for her professional career. Her name is Annette, and she was actually going to go to Stanford for her residency. So I was immediately intrigued because she was a student council colleague and friend. So I again made immediately a mental note to learn more about this field. We were lucky at Michigan at that time to have exposure to some of the great teachers in otolaryngology, the late John Kemmink, Charles Krause, the late Charles Krause, the professorship, whose name I hold in great honor. Again, I had great exposure to these wonderful teachers and mentors early in medical school.
So then you decided to do otolaryngology, and then again, how did you come into head and neck surgery? Did you decide that during residency?
Yes, again, very early on, and I was even thinking about it as a medical student because I loved being able to help patients and families at the crossroads of life, which is really what cancer, everything becomes very clear as a patient and a family facing a life-threatening diagnosis. I also thought that I like to use a scalpel more than I like to use a drill. Although some of my teachers did want me to pursue otology, but my true love was head and neck cancer surgery. And Ray Escalamato was again then at the University of Michigan, along with later on Bill Carroll. And again, they were teachers and mentors, role models, I would also add. And when I first joined the faculty at Michigan, it was Ray Escalamato, Bill Carroll, and I were sort of, and I was at that point in time the new kid on the block, but they were wonderful teachers, role models, and mentors for me. And again, see them to this day, and great friends to this day.
Right. Well, that was actually my next question, was to ask you about your mentors. And what did they impart upon you as a young faculty member?
Pursuit of excellence, care deeply, always have the moral and ethical high ground and never ever compromise that. I think, and I should add, Chuck Krause, again, recruited me as a resident and then recruited me to join the faculty, and really throughout my career was an amazing role model. I probably, how to take care of patients and families, how to have a professional, but in some respects, a deeply caring relationship, again, because of this dealing with patients and families at the crossroads of their lives. And so learning really how to develop, long-lasting professional relationships with patients and families. As you have said, I'm now in the dean's office. I'm no longer chair of our department, but I still love Monday Clinic, and I love sharing stories. Some of my patients recall and ask me about my children, because I had children early in my career, and so we share those stories collectively. And when you overcome cancer, there's quite a bond that develops.
Yes, with the patients.
With the patients
and it's
and
long
family.
term, which is so nice.
It's forever. It's forever,
yeah.
really. It's forever.
Yeah.
It's one of the best parts.
So what about anyone outside of Michigan that was an influence on your career?
Great question. Because I've spent my whole career at Michigan, a lot of my workplace mentors were there, but there were many, many people in the society that made a big impact upon me. And probably one of my earliest sponsors, again, just saw him here today, was curiously Pat Gillane. Great leader in our specialty and in the American Head and Neck Society. And I remember sitting next to him at the American Head and Neck Society business meeting, and I was a junior faculty member. I was a member of the American Head and Neck Society, and it was nominations for the floor for the finance committee. And he looked at me and said, "Carol, do you want to do it?" And I said, "Sure." And he said, "I nominate Carol Bradford," and nominations were closed. And so that was really my first committee role for the American Head and Neck Society, and I was immediately a part of this important organization. It was a 6-year term, I think 2 3-year terms. In the middle of that, there were some financial challenges that led us towards the pathway of working with BSC to this day. So that gave me my start. Many other people, too numerous to name, colleagues, friends. Dennis Krause was a 6-year secretary of this organization and past president. Greg Wolf was, when I joined the faculty, he became the chair at Michigan, and he served on council and was also a great leader in this society. And as the first female president of this society, it was a true honor to serve the society. And I was fortunate to be president at one of the international conferences in 2012 when John Irish was program chair. And it turned out it was in John Irish's hometown. And so he, the Hockey Hall of Fame and the past president's dinner on the island. I mean, it was just, and the presidential suite. I mean, it was just a fabulous, wonderful experience that I'll never forget.
So from the finance committee all the way to president of the American Head and Neck Society, how did you decide that day, I'm going to be president of AHNS one day, or?
No, I had no idea. I had no idea. And there were things in between, because that was a lot of years. I served on many different committees and then ultimately served on council as a fellow at large. And I was part of the Advanced Training Council. I was part of all sorts of different parts of this organization. And then, as you may know, there's a few different pathways to be president. Mine was actually the easiest pathway because I was never treasurer, which is usually 2 3-year terms, or secretary, which is another 2 3-year terms. But every once in a while, there's an at-large nomination, and that was the mechanism that I got in. And it's really 4 years prior because you're vice president, elect, and so it takes like 3 or 4 years to actually become president. And then I was on council as past president for a few years. Other things that I was involved in that I really loved, I was part of the foundation board for many years and doing the fundraising. And so, I think that the American Head and Neck Society is an important part of my professional identity, and I think it certainly was a big part of my professional identity.
Well, thank you for your service. And what would you say is your contribution to Head and Neck Society?
So that's, so thanks for asking that question. I think that I came through the American Head and Neck Society when there were not so many female members. In fact, when I joined the Head and Neck Society, I think it was Ernie Weimuller at the sort of reception of new members, they were handing out ties. And when it came to me, he just simply pulled it back. And so everybody else had gotten something, and me and maybe a couple other women had gotten, nothing, because I wasn't going to wear a man's tie. And so I think along the course of time, I said, why don't we do scarves?
Yeah, what a great idea.
Which
Yes.
Of course they now
Thank
do.
you.
I don't have those now, but I do think, that I have been an advocate for all head and neck surgeons, but an advocate for women in the American Head and Neck Society. And part of that, I was also very involved in, there was a time when there were few fellows applying, few residents applying for fellowship in head and neck surgery, because it was at that point, not judged to not be hard work and not very much money. And so it was actually I and somebody in New York, Jay Boyle, did sort of a marketing campaign and did this fellowship thing that, again, still exists to this day, but it was he and I, and we said you can be a head and neck surgeon, you can still have a great life. It creates great professional satisfaction. We did that for years and years. And probably not just because of that, but then applications started to skyrocket to the field. And so I think, it's awkward to say one is a role model or a mentor, but I do think creating, allowing people to see that I could be a head and neck surgeon, I could have balance in my life, and it can all still work. I think added some value.
Yes, yeah. I think I was probably the product of all that marketing. So a lot of people in the field when I applied for fellowship. So what about at Michigan? You've had some important leadership roles there. How did you come into that?
Right, so while I didn't always envision being president of the American Head and Neck Society, but I was, again, so very, very honored to be chosen for that, I did always aspire to leadership and probably, honestly, aspired to be chair someday. I had done all my training at Michigan and spent my entire career there and had great admiration for the academic mission and the tripartite mission, really. I rose through the ranks. I was associate chair for clinical programs and education. I was division chief of head and neck surgery, and I was head and neck oncology program director in our comprehensive cancer center, now renamed the Rogel Cancer Center due to grateful donors, wonderful donors, Rich and Susan Rogel. That just happened about a month ago.
Oh, exciting news.
Very exciting news. But, the perfect job for me was to someday be chair at Michigan, which I think is a fabulous training program, research program, and clinical program. And so I was really lucky to be selected for that role in 2009. It was not a linear process. I didn't make the short list, but was eventually chosen to be chair. And I served in that capacity for 7.5 years and truthfully loved it. Loved every moment. We recruited 22 faculty over those 7.5 years, lost only 2, and I think even those 2 are still deeply connected to their past association with the department. And I always have said, once you're a member of the Michigan Otolaryngology family, you're always a member. You can never leave the family.
That's nice.
And I thought I'd never leave that role. We had a reorganization at Michigan where this new role I take, the Executive Vice Dean for Academic Affairs, opened up, and I oversee the faculty and the educational, all learners, students, graduate students, residents, fellows, and postdocs. And I did decide to throw my hat in the ring because there was a lot of oversight over not just one department, Odo, but over 20 clinical departments. And I never thought I wanted to be dean, and I never actually thought I would do anything else, but I decided to throw my hat in the ring and was chosen to serve. And again, it challenges me every day, and it's really an opportunity. The only reason I chose to do that is in order to serve the institution I love and to continue to aspire to excellence across the tripartite mission.
So in terms of when you were the chair of the Otolaryngology department, what were some of the big initiatives that you did during that time?
Right, so the first thing we did was to gather the faculty together and really decide on our mission and vision and utilize that to drive everything we did. And so we had some retreats. We talked about what we were really there to do, what we were there to strive for, and we built what we called our vision and mission statements that live to this day. Now there is a new chair. Mark Prince has just been named, and so if he wants to update that. I wouldn't say I did a strategic plan. I'm doing that exercise now in the dean's office, but I think what we did is we really subscribe to excellence. We recruit the best and brightest people and develop those people and try to retain those people. And our mission and vision statement was for faculty, learners, and staff. And so, we had great research programs. I recruited our next director, our current director of Kresge Hearing Research Institute. And I think really subscribed to the philosophy of hire great people and then largely stay out of their way. And so we built great programs: vocal health, facial nerve, pediatrics, otology, neurotology, balance, skull base. One of the last things I did prior to going to the dean's office is we had a general otolaryngology division called LARGO, laryngology, rhinology, and general otolaryngology. And then we had a facial plastics division that included skull base, but the fields of rhinology and skull base had become a continuum. But those specialists were actually in 2 different divisions. And so the last thing I did was create a rhinology and skull base division and appointed Erin McKean, who is somebody I had known since medical school at Michigan. She'd worked in my laboratory as a medical student for a year, and appointed her to lead that division. So we also, from the days of Chuck Krause, had a diversity committee, and so we really subscribe to diversity, equity, and inclusion initiatives. And that was on our first rendition of all of our mission statements. We didn't include that yet, and then David Brown helped me realize we'd missed an important element of our mission, and so again, that was included, because vision and mission statements should, you can moderate those over time.
Yes. Well, that's wonderful. How do you think the field of head and neck surgery has changed since you decided to become a head and neck surgeon? Have you seen a lot of changes?
Yes, I've seen vast changes. In fact, when we began, we operated on all tonsil cancers. We didn't do any chemoradiation. In fact, we didn't even, the VA larynx study was published in '91, and I started on the faculty in '92. So chemoradiation for larynx cancer, we were pretty involved in it. Greg Wolf, one of the leaders in our field, really pioneered that treatment. But we operated on everything else. We saw the emergence of the HPV epidemic, which we actually studied in our laboratories, and were some of the first to make important observations about the HPV epidemic. So thinking about functional outcomes, the appropriate use of chemo and radiation, avoiding toxicity, survivorship, transoral approaches, you know, what they now call transoral laser surgery, I used to do, because early on we still have microscopes and lasers, so if you could cut it out with those techniques, that we definitely would do. But the robot has clearly been a major advance in the field. Another thing that has been a big part of my career was the management of cutaneous melanoma and the entree of otolaryngologists, head and neck surgeons into sentinel lymph node mapping. That became a big part of my career. I was one of the first head and neck surgeons, I believe, to do what they then called hot blue dye mapping. But I think that's been transformative for our field.
Yes.
It's an exciting time for the American Head and Neck Society with our new sections, and an opportunity for many, many more people to become involved, because it has been such a big part of my career. I really look forward to it being a big part of so many other people's careers.
What do you think now, as we look to the future, what do you think are going to be some of the challenges or things that we come into the future of head and neck surgery?
So I think that there's another paradigm shift happening, and that is going from fee-for-service to value-based payments. And so I think there will be enhanced focus on quality. In fact, I just came from the quality session here. Individual and team-based quality outcomes. When we talk about value, how can we lower costs, lower side effects, lower complications, and have the best outcomes? I think it's an interesting thing to consider. Where should we do major head and neck surgery and free flap reconstruction? Should that be in every town in the USA, or should that be in some towns, or big research and teaching places?
That's an important question.
Very, very important question.
So thank you so much for doing this. I do want to just kind of ask you, you're such an important role model. I know that many women head and neck surgeons have looked up to you, and all of us as members of the Head and Neck Society, but thank you so much for working so hard all this time and continuing to contribute to our field now. How would you impart some words of wisdom for young people coming into head and neck surgery now?
Right, so I think that's great. My advice to young students, otolaryngologists, or head and neck surgeons is really the same advice I give to my children, which is that life is about pursuit of dreams, and if you dream it, it can actually happen, and so go for it. But remember to have balance. Most people know that I talk about an email holiday. I try to take an email holiday one day a week, which people think is insanity, but I think it's great to have a life outside of medicine. But it's what a privilege and honor it is to be a head and neck cancer surgeon, and I can't have imagined choosing a professional career that would be more professionally satisfying. And you know, not a day goes by when I'm in clinic where patients don't thank me, patients and families don't thank me for saving their lives. Now, you know, we don't save every life. I know some of our patients do not conquer their cancer, but I think regardless, you help everybody, whether or not you save their lives. And so it's been just a privilege and honor. So go for it. Pursue your dreams.
Thank you very much.
Thank you. Appreciate it.